I'm pleased to welcome Dr. Lori Medeiros from Rochester Regional Health, the Breast Center Director, back to the program. Doctor, it's great to see you again.
You too, thanks.
It is October, as you're well aware, and as our viewers are well aware, many of them, this is Breast Cancer Awareness Month, and I want to begin with that term, awareness. People certainly want to be aware of breast cancer or the signs of breast cancer, but a new study really indicates that many people are not aware.
Right. I mean, I think sometimes in our enthusiasm for mammograms, which certainly are our best screening tool, we kind of lose track of the fact that they're not perfect. So there are things that you can do to help improve your odds of trying to find a breast cancer early, in addition to undergoing your yearly mammogram.
Well, one of the things that women certainly can do is do a self-breast examination.
Sure. Yeah.
And most women will know to try to feel for a lump.
Right.
But that's not the only thing that they can be looking for, right?
Well, you know, I think a couple of things. So mammograms can fail in certain situations. It's really important to be aware of your breast density. So women often will get a letter. Well, in New York State, you'll always get a letter letting you know what your breast density is. And sometimes it's a little bit of a black box when you get that letter. What does that mean? The things to be aware of is that if your mammogram is being read as being dense or extremely dense, then what the mammographer is telling you is that your mammogram is hard to read and things can hide in there. There are some breast cancers that by their very nature can escape mammographic detection. And these include things like lobular cancers. And the kinds of things that they show up with are a little bit different sometimes than just a lump. So sometimes we see a breast that's shrinking, okay, that's getting smaller, dimpling in the breast. So if cancer grows on the ligament, sometimes it can pull that skin in and cause a little dimple. Redness on the breast that doesn't resolve with normal sorts of things like a week of antibiotics, you know, sometimes can be an indicator of something called inflammatory breast cancer. And certainly changes in nipple output, so someone will start to develop a bloody nipple discharge or even just a clear, sticky nipple discharge. And sometimes that can be just cancer cells that are there, and that's our early warning sign.
So many women will look to take this time of year, October, to go ahead and have their mammogram.
Right.
But obviously this is a year-round thing.
Yeah.
And it doesn't end on October 31st, does it?
No, right. You know, awareness is something you want to be diligent about. Women get, I think, caught up in this idea of what am I looking for in a breast exam. Subtle things, that's not what you're going after. You're really trying to figure out what's normal for you.
And really there's an element there of knowing your body.
Right.
You know, being aware of what feels different.
Right.
Or what looks different.
Right. And then also understanding that a mammogram is not prevention. And I think sometimes we get kind of lulled into a false sense of security. You get your mammogram and you're like, oh, thank God, I'm done. But the reality is, it's just a snapshot in a moment in time, right? So things can change. And if you're finding that you're seeing changes, that's really a time to go and talk to your doctor and say, hey, listen, you know, I'm noticing this. Does this look normal? And should we look at this again at this point in time?
Thank you.
Yeah.
Appreciate the conversation. So awareness and proactivity, as always, the keys here. Lots more online. Great resources, rochesterregional.org/breast center. We're sharing that link on our site as well at rochesterfirst.com.